I thought I'd put this video together. Now, I haven't got private health insurance, and I haven't had private health insurance for quite a few years now, mainly because I'm a pensioner and I can go onto my S1, which is the NHS is paying for my healthcare here in Spain. But for those coming over, especially on the non-lucrative visa or the digital nomad, you're going to need some form of private healthcare, because if you don't, guys, they won't allow you in. So Spanish health insurance is pretty important. Now, I was contacted last year by somebody who is with a well-known make. I will make a disclaimer. I'm not going to mention any of the insurance companies. Don't contact me, guys, about who would I recommend. That's up to you. Yeah, like I said, I'm not going to mention no names. Anyway, he's with a pretty well-known insurance company, health insurance company, I should say, here in Spain. And I'll just give you a quick brief on what happened to him and also what happened to me. So he had a really bad pain and he went to the doctors, and the doctors referred him to the hospital. The hospital couldn't find anything wrong with him, but while we was in there, obviously you have to pay for the treatment. His insurance company contacted him to say, sorry, you're not covered for this type of treatment, which to him at that time, it was fine because he was in so much pain. He just wanted to get the pain relieved. But anyway, they said they couldn't find nothing wrong. So he was still in so much agony. He booked himself out and went back to the UK. Anyway, they found that there was a problem. They solved the problem. And then when he got back to Spain, he contacted the insurance company, who then said he was insured, but he'd already paid the money. You get what I'm getting at now is he paid out the money and they're refusing to pay for it. So he wasn't happy with the service. I think that was the main problem. He just wasn't happy with, you're paying money to be treated better, really. And the funny thing is, I've got what I call it, what's it called now? It's called a script generator. And what's good about it is I can put on there, now what I've done, I put Spanish health insurance, is it any good? And it comes up with a load of blab. And it'd be interesting to see your feed, because the whole point of this video is to see how many other people out there that, especially have got private health insurance, are you getting a good service? I'm sure a lot of people are, but I no doubt there are a few that are not. I'll just go on to what happened to me. Now, obviously, when we first arrived here in Spain, we were still under the pension age, so we had to have I don't think, to be honest, at the time, this is before Brexit, guys, I don't think personally we had to have insurance. I can't remember now. It's something to do, because we weren't residency, we were still non-resident. But anyway, we took out private health insurance, and I think we was paying about €200 a month for the both of us, so that's €100 each. It was not too bad, but we did have the full whack, the golden card, as they say. And to be honest, I think the first year we was pretty chuffed with them. We had a proper, like I class as an MOT check. We had a disc on us. Everything was on record. And then when the second year turned up, bit weird, I had to sort of rebid my figure. I mean, they'd put the price up. That's the thing. Some don't, some do. Anyway, we come to an agreement. Yeah, I'm happy to pay that. It wasn't a lot more. I think it's an extra €20 on top. But we didn't get the MOT anymore. The receptionist was supposed to speak English. Sometimes she did, and sometimes, obviously, we got something else different on there. Because this is the other thing, you're paying for that special treat, special service, really. Anyway, thankfully, our age was coming up, our pension age, so we applied for our S1. When we done that, and we knew it was on the Spanish health system, we closed down the private health insurance. Now, some people carry on. Some people like having private health insurance, even when they got, the Spanish health system, if you get what I mean. But anyway, we shut ours down. They told us we've got to give it a month's notice by email. Thankfully, we did that. And you get a response, you get an email back to say, yeah, it's been cancelled. Well, obviously there was a communication problem between the office that the clinic that we used to go to, I would presume the main headquarters, wherever that would have been. I think after a couple of months we had a letter to say, you haven't paid, can you pay your money up? So I phoned up, I emailed, nothing other than, okay, whatever. And then we had, I think it was by Easter time, we had a threatening letter saying that they were putting an embargo on us. They wanted a full amount of money. And then I think I must have spent every day I would send an email to them to say it had been cancelled. Still no response. I would phone up one place and they would put me on to somebody else. I mean, for somebody that probably didn't want all that hassle, they probably would end up paying for something they didn't even want. That's what annoyed me. And when they finally agreed, yes, we had cancelled it, even though we had proof, no apologies. I wouldn't, anyway. Since we've been here, we have been on the private doctors. Where we live, there's a private doctor scheme where you pay €20 a month each. So if we need to see the doctor, and the main reason for that really was that we could see the doctor straight away, obviously get prescriptions and things like that. We didn't use it much, so we've cancelled that contract now, because the other thing that I wasn't happy about, we had no membership card or nothing. And when we inquired about that, it was sort of looked at us blank, and they had no records of us. So I didn't really see them. Anyway, that's my opinion. So I thought, while you're watching it, because there must be loads of, not loads, there must be some people that have been treated pretty bad. Guys, it'd be great to hear your experiences. You don't have to put too much, but you can put it down below in the comments. And it'd be good to hear if you had a fantastic service, because I suppose like anything else, we always hear about the bad stuff and we don't hear about the stuff that they do really well. But anyway, I thought what I'll do, I'll just go through my script that I've looked at, and it's always interesting because I think it's a bit over the top, and it starts off with, this is how I would have portrayed the video to. I ain't gonna do this, what they say. Opening scene, energetic music, cut to the host, and I'm in a outside somewhere, maybe on a beach or in a park, and I say, "Hello, amigos," or "Hola, amigos." If you're living in Spain, thinking about moving here, or just curious about the health insurance, how it works, a beautiful country, then stick around. Today we dive into the Spanish health insurance. What's good, what's not, and everything you need to know to navigate this system like a pro. I don't understand that bit, but anyway, cut to the host walking through the park, or various people enjoying life in Spain. Now, you might have heard that Spain has an exceptional healthcare system, and that's true. The public healthcare system here is ranked among the best in the world, but how does it actually work? Let's break it down. And then it goes, the host. First up, let's talk about it all began. Spain has a universal healthcare system, which means that residents have access to healthcare services regardless of their income level. Isn't that incredible? Well, that's what happens in the UK, I'm right in thinking, on the National Health Service. But obviously, I know some countries don't do that. But what does universal actually mean? Then the host, a visual, whatever that is, background thingy. Well, for citizens and legal residents, governmental services cover a large swath of medical needs. This includes primary care, hospital stay, specialists, and even emergency services. Overall, around 90% of the public healthcare system is funded through taxes, which means more money for healthcare and fewer out-of-pocket expenses. However, that doesn't mean everything isn't perfect. Access to specialists can slow at times due to waiting lists, and some people may find certain treatments or medication harder to get. So if you're going to live long term, many expats opt for the private health insurance. This brings us to the next topic, private health insurance in Spain. So why consider private health insurance? Several regional first, quicker access to specialists and electric treatments. I don't know what you're on about. No, it doesn't say that. I don't know about you, but I can't stand waiting for weeks or even months to see a doctor. Also, private health insurance offers many options regarding hospitals, medical professionals. It can be a game changer when navigating healthcare as an expat, especially if you're not fluent in Spanish, so just want an English-speaking doctor. That's a good one, that one. Okay, so number 1, shorter wait times. Number 2, more healthcare options. Number 3, English-speaking doctors, private rooms in hospitals. Now, I'm just, before I carry on with the blab there, I have to be honest. Now, I'm on the Spanish healthcare system, and my hip just got worse and worse while I've been in Spain. So I had to go and see the specialist, and they said it'd be about 6 months, and they were quite correct. But he also said I'd go into a private hospital to have the actual treatment done, which was also correct. And I also had my own private room. English speaking, I did have to use a translator at times, but most of them did speak English. And I'll be honest, I had a very good service. I couldn't complain. I was in and out within a couple of days, and I'm running around like a lunatic. Not really, but yeah, I can't complain about the system. Now, I know some people that I do know, obviously on the Spanish health system, and they've been waiting yonks for specialised treatment. So that, I know that does go on. Anyway, getting back to this. All right, so you might be wondering, how much does this all cost? Wow, private health insurance can vary widely based on ages, coverage type and provider. On average, a basic plan can cost anywhere between €50 to €150 per month. Sounds reasonable, right? I don't know about that, but they're correct in the sense, obviously it will depend on your age, and it will depend on, obviously, previous problems that you've had over the years. And I suppose for a single person, that's possible that you could be paying 150. I don't know. I don't know what the cost, like I said, when we was there back in 15, 16 and 17, we was paying about just over 200 a month. So that's for 2 of us. So I would imagine it's gone up since then. Here are a few tips for selecting the right instances for you. Elevate your healthcare needs based on your age and lifestyle. Check if your preferred doctor or hospital is included in the plan. Consider the coverage of treatments and emergencies, and compare prices and service by using online comparison tools. Right, don't worry folks, we're near the end of it now. But what if you're just visiting Spain? Don't worry, travel insurance is an option for shorter stays, and plus always check with your medical services are included. So they're on about I think it's the ECI card, something like that we come over, so you can get basic, if you cut your arm or something, that sort of treatment. So anyway, now he goes into, I've got to have the other landscape behind me again. So in summary, whether you opt for the public healthcare or the private route, Spain has your back when it comes to health. Just make sure that you do the research. Well, that's the main thing, guys, is research. Ask the questions, another good one, do ask the questions, and choose wisely. If you found this video helpful, don't forget to like, share and subscribe. Let's keep the conversation going. What are your thoughts on the Spanish healthcare system? Drop them in the comments below. Next time, take care. So good. Some of that was I thought pretty informative, especially the part at the end there. Yeah, I mean, it'd be great to hear from you guys, because the reason why I like doing these videos, it's not just me blabbing away, but also hearing if you had problems with your health. And we're not just talking about private health, we're also talking about the Spanish health system. I mean, from what I can say, here we're pretty good. I can't say our health. We've actually got a health centre here where we live, and it can be a bit annoying where you can sit in there for ages only to find out you're not even on the list. Even though they are a bit high tech, we got an app and we can do it on there, but still sometimes it doesn't always. Anyway, but I would imagine that's the same back in the UK. The UK was just as bad. So, guys, hope you enjoyed the video. As always, there's going to be another video coming very soon.